Understood. What is an ectopic pregnancy, doctor?
Ah, so, we talked about the pregnancy, the egg being fertilized and then traveling through the reproductive tract and ultimately implanting in the uterus. And the uterus is where that pregnancy will develop and grow. For a variety of reasons, the pregnancy that does not reach the uterus and starts to develop outside of the uterus, and the most common area for that is actually in the fallopian tube. That is an ectopic pregnancy, a pregnancy that does not develop in the uterus or in the wrong place. It is a relatively uncommon occurrence, although there are some patients who may be at higher risk for it, patients who may have had previous fertility surgery or previous tubal surgery, actually patients who may have had a previous ectopic pregnancy are at higher risk also. And the rates of how often this happens really deals with patient populations where there's a higher risk of pelvic infections. That may increase the risk also. So it could occur anywhere from 1 in 80 pregnancies to more commonly 1 in 200 pregnancies. Uh, the ectopic pregnancy in and of itself is one aspect of it. Occasionally I have patients who say, well, I don't want to deal with any complications, but this is potential life-threatening condition for the mother. That pregnancy that's developing outside the uterus cannot develop appropriately in a fallopian tube or even rarer cases in the abdominal cavity. That needs to be dealt with in the past traditionally surgically, but more often nowadays when a diagnosis is made early on, it can be treated medically. And that is not a pregnancy that can be sustained or maintained and certainly has a potential life-threatening risk to the mother's health. So it's important for those patients who may be at risk for an ectopic pregnancy to work with their obstetrician to determine that the pregnancy is actually indeed located where it's supposed to be in the uterus rather than outside the uterus or in an ectopic location.